Now, I'd like to give you some location-specific plans, and I've chosen the area of Maricopa County, Arizona. Now, remember that if you do not live in this county, that there are others that you can talk to your benefit advisor at Extend Health to give you specific plans in your county as well. So these are samples, and they're just examples of in 2010. We do not have the pricing for 2011. We will not have that available until the middle of October. You can then call and find out specifically for 2011 what those plans will be. As you can see in Maricopa County, there are 13 Medicare Advantage plans available that range in price from $0 to $147 per month per person. And these are the companies that will be offering those plans: AARP, Cigna Humana, Scan Health Plan of Arizona, Sterling Health Plans. There are 21 Medicare or Medigap Medicare supplement plans, and that range from $70 to $229 per month with AARP, Blue Cross Blue Shield of Arizona, all the way through to Secure Horizons. We also have 15 Part D, that's the prescription drug plans, that range in price from $18 to $82 per month with AARP, Aetna, Cigna, Coventry, and Medco. Now, I'm going to go in specifically and talk about some of these plans. For instance, there will be vision and dental plans available. There is one vision plan with VSP or Vision Service Plan at $14 per month per person. Your annual eye exam is a $15 copay. As you'll see, there are two dental plans, Delta Dental and Humana, ranging from $16 to $43 a month. The deductible would be 0 to 50 depending on which plan you chose, and the annual maximums are $1,000 to $1,600. Now, look at this. We are going to get specific about some of the Medicare Advantage plans. We've chosen Humana Choice PPO to give you an example. Now, if you'll understand, Medicare Advantage plans include a prescription drug plan, and it will cost you $80 per month per person for your premium. This is a PPO, which is going to allow you to see your doctors in your network. You can also be covered out of network, but it will cost a little bit more money. Now, when you see a doctor, it will cost $15 copay if it's your primary care physician. If it's a specialist, it will be a $35 copay. If you're in the hospital days 1 through 7, you will pay a copay of $195 per day. If you're in the emergency room, it would be a $50 copay. And if you will notice, your prescription drug plan is included, but you do need to pay copays. There is a 4-tier in any prescription drug plan that you pay. The tier 1 is generic, it's a $7 copay. Tier 2 is name brand. That's a $42 copay. $80 copay for non-preferred brand and 33% for specialty drugs. Your mail order is discounted if you order a 90-day supply through the mail. Now, the next thing I'd like you to see is you can compare it with a Medigap plan. This is a plan F. F is in Frank, and it's not including, but we're adding an AARP preferred prescription drug plan. Medigap plans do not include the prescription drug plan, so they are an add-on to this. So with your Mutual of Omaha Medigap plan, you're going to pay $112 per month premium per person, and you're adding a prescription drug plan. The one we chose is through AARP, and it would be a $35 per month premium. So if you add those two together, you're looking at $147 a month for both. This is a little bit more money, but if you'll notice, there are no copays. You can go to any doctor anywhere in the United States, and you'll be covered as long as they accept Medicare patients as well as hospitals. You can go to any of them. There is no deductible. There's no copay for the doctor, none for the specialist. If you're in the hospital, there is going to be a 0 copay. It is by far our most popular plan. If you're in the emergency room, again, 0 copay. So what you're looking at here is you're paying a little bit more monthly, but then you have a peace of mind knowing that virtually everything after that is paid for. Now, the one that we are including with that, your prescription drug plan, is with AARP. It's called AARP Preferred. Notice the copays for each tier: $7 for tier 1, $42 for tier 2, which is name brand, $79, 33% for specialty. Again, their mail order gives you a discount if you order a 90-day supply. Now, just to make sure that we understand one more thing, you have to understand the donut hole, and I'm going to try and explain that a little bit. First of all, for 2010, it was a $2,840 that you reached before you hit the donut hole. For 2011, it went up $10 to $2,840. You know that when you get a prescription drug, you'll pay your copay, but the full retail price of the drug is what is counted toward that $2,830. That is when you hit the donut hole. Now, when you hit the donut hole for 2010, you had to pay 100% of your drug costs until you had actually spent $4,550. For 2011, it's changed. You will only pay 50% of your drug costs while you're in there. The drug companies are covering the other half, and the full amount of the retail cost still goes toward the $4,550 that brings you out of the donut hole. Then you'll reach catastrophic coverage where you'll pay only $2.50 for generics and $6.30 for brand names, or 5%, whichever is greater. Now, lastly, we just want to make sure you call our customer service if you have any questions. We are there for your appeals, network questions, anything that you may have questions about. Please call your benefit advisor. We will continue to renew your coverage each year. You can stay in the same plan, or you can change during the annual enrollment period, which is going to be November 15th through the 31st of December. And we will continue to also enroll the people who are turning 65, so you can call us 3 months before you turn 65. Now, the next steps are very simple. Review your Getting Started guide, gather your Medicare card and prescription drugs, and get those together with your doctor information, because that's educating us so that we know how to get you into the right plan. It's very important that we match the plan to your needs. Now, the number that you need to call is 888-598-7470, and please feel free to call as many times as you'd like, whenever you'd like, to our benefit advisors at Extend Health. This is a dedicated line for Honeywell retirees. There's also a website, www.extendhealth.com/Honeywell. This is also going to be dedicated to the Honeywell retirees, and it will be on any information that is sent to you in the mail. Now, we've enjoyed speaking with you. Please remember that we're here to help you. If you have questions, we have the answers. Please feel free to call us, and we hope you have a great day.